As surgeons, we are continuously striving to be better. The journey to becoming a great gynecologic surgeon is lifelong, built through skill, experience, and a commitment to improvement. But what truly defines a great surgeon? In this video, we hear from leaders in SGS, surgeons who have shaped our field through their expertise, mentorship, and dedication. Their insights help us explore what it means to be great and how we all can continue growing on this journey.
The pat answer from the 16th century is the eye of an eagle, the heart of a lion, and the hands of a lady. But I think that there's more to it than just those kinds of basic principles. I think the first thing that I think is a commitment to be better tomorrow than you are today. That it's the attitude of an athlete or a musician who's trying to incrementally get better every day of practice, and to think about reflecting at the end of an operation on what went well and how did that do well, and then at the same time to say, if we had a do-over, what would we do over again?
So I've thought about this. The number one thing is curiosity. You have to be curious about what you're doing, how you're doing it, how you can get better, what's happening with your outcomes. Meticulous attention to detail is something that makes everyone a better surgeon, both in terms of learning to discriminate subtleties of surgical fields, subtleties of approach.
I think it's somebody who prepares for the operating room, somebody who is willing to be introspective and really determined to practice to become a better surgeon.
10,000 hours. 10,000 hours. Practice, practice, practice. Don't give up. You'll be good at it.
First of all, I think you have to be a good doctor. That's the prerequisite. You have to have all the qualities of being a good doctor. So it's attentiveness, attention to detail, lifelong learning, and adaptability. There's very few things that I do now that I did 20 years ago.
I think GYN surgery is really about understanding anatomy, understanding how to navigate the spaces of the pelvis, and being able to do so using multiple modalities.
Intelligence, the ability to see things and translate them into motion, the ability to feel where your hands are in space. So visuospatial recognition and somatosensory perception.
I think, you can say they have good hands. I would also say they have good eyes. You have to, understand the anatomy. You have to understand how to get out of complications. Doing the surgery itself is, and sometimes the easiest part. So it's knowing when to operate and when not to operate.
Well, certainly good hands, good technique, knowing the procedure, things like that. But I would say it's really the decision-making that is needed. And that decision-making occurs even before the operating room. It is who you operate on, what procedure do you choose. Then in the operating room is somewhat taking control of the room. You are responsible. And how to avoid complications, how to manage them when they occur. And the other thing is to know when to finish, get out of Dodge, I call it. So knowing when.
Well, I've come with the 3 E's. One is the economy of movements. Every movement you do in surgery has to have a purpose. Second, it's efficiency. You finish one step in the surgery and you go to the next one. And the third one is elegancy.
Oh, what makes a good gynecologic surgeon? I would say, I don't know how you can quantify it, but there's a judgment factor in there. There is a decision to take someone to surgery.
I have a quote. It's probably one of my favorite quotes about surgery, which not everybody agrees with. I would like to see the day when somebody would be appointed surgeon somewhere who had no hands, for the operative part is the least part of the work. I think it's really the mind that makes a great surgeon.
I think a good gynecologic surgeon is someone who is skilled both in the art and the science of surgery, and someone who thinks about individualization of care for patients.
With being a really good listener is crucial. There are so many different, not particularly yet data-driven options that we provide our patients that can affect many different parts of their quality of life. And without being a good listener, you might just jump to interventions that are inappropriate. And so I think it's really crucial to start with being a good listener.
It's what others may call, the art of medicine and the art of surgery.
I think a good surgeon has to pay attention to both the art and the science.
The surgeon has to really know the subject, that's obvious, but they have to know the anatomy. As you get more advanced, anticipating, preventing, but then also solving problems or avoiding complications. And then I think a really top-notch surgeon should be at least aware of their results. You should be seeing your patients back and seeing how well you're doing so that you can then learn from your good outcomes, but also learn from your poorer outcomes and your complications.
The key to being a good surgeon, first and foremost, is being an extremely humble surgeon. Repetition and being the biggest critic of yourself. But first, ultimately, it's being able to admit and talk about not the great things you did, but the things that didn't go so well.
The patience is huge in the OR.
The one thing that I think makes some people stand apart is both like situational awareness and judgment.
No, any single patient is necessarily exactly the same. So being flexible enough to change it up in the operating room when something unexpected happens or something's not going exactly as textbook or predicted, I think that is part of what makes a good gynecologic surgeon.
To be honest, planning for the surgery, you're basically preparing for something that might happen, an ambush or whatever, but you're doing it, the whole thing before the actual event. Being adaptable within the surgery itself, because the anatomy will be different from what you anticipated.
I think a good gynecologic surgeon is a problem solver, ability to be very kind of see the tissue plan to solve the problem, and always have the plan A, B, C, and D in your mind ahead of time. A lot of times things are gradual. It's not like overnight, all of a sudden that you become a good surgeon.
Obviously, you have to have reasonable hand-eye coordination and just some innate things, but the ability to focus, the determination to want to be better and to do the things that you have to do to get better. You have to have volume and good mentorship. A drive to want to be better separates, I think, the great from the good. There's no plateaus, right? It's constant learning. The ability to critique yourself without burdening yourself is also a skill that really pays off.
But it's that attention to detail and the never being satisfied with how things are, always working to better yourself, make yourself a better surgeon, because ultimately it's truly our privilege to be able to operate.
Great surgeons don't just reach excellence. They keep pushing their own boundaries. They recognize that change is essential, that progress comes from constant learning, and that transformation happens through connection and collaboration. And we don't walk this path alone. The Society of Gynecologic Surgeons has always been built on relationships, connections that challenge us, inspire us, and push us forward. As surgeons, we are more than skilled hands. We are agents of change. Through research, mentorship, and innovation, we shape the future of gynecologic surgery together. As we move into our panel discussion, we invite you to reflect on your own journey, how you've grown, how you've overcome obstacles, and how we can all continue to push the boundaries of excellence in our field.